Finding the right caregiver may feel overwhelming, but with the right information, you can absolutely make the right choice and the best fit for your loved ones. In this video, I'm going to break down the different types of caregivers and help you decide what the best fit for you and your loved one is. My name is Mitchell Brodsky. I'm a physical therapist and patient care coordinator with Premier Companion Care Services. I'm here to answer your questions about home care. We know that making decisions for home care isn't always easy, and picking the right type of care for your loved ones can definitely feel overwhelming. We're here to answer your questions about home care. Make sure you watch the rest of our videos on our channel. What are the primary types of caregivers? All right, so the first would be a family caregiver. This is somebody who's doing all the same things that a home health aide would be doing, but they're not getting paid for it. It's a family member caring for a family member. Second type of caregiver is a professional caregiver. This is somebody that you would typically hire from a caregiver agency, such as ourselves, to come in and fulfill the role and needs of a caregiver. A lot of times people decide to hire a professional caregiver when they cannot fulfill all the obligations and duties of a caregiver themselves. Third, an independent caregiver. This is somebody that you would consider a freelancer. They have all the same skills and qualifications of a home health aide, but they are not backed by an agency. They are just representatives of themselves. Fourth would be a Waiver or Medicaid caregiver. This is when the client is enrolled in a care organization such as UPMC or Keystone First. They get state-appointed hours for care, and then their caregiver can either be somebody from the family who's getting paid through the state or your agency, or it can be somebody that the agency hires to come in and take care of you. 5, respite caregivers. These are short-term caregivers that are coming in to provide the typical caregiver respite care. So for instance, if you were taking care of your mom or dad and you just needed some time off to reset and recharge, you can hire companies to do short-term care in that absence. Now, this can range from 8 hours all the way up to 24 hours for a week, 2 weeks, 3 weeks. Whatever you need to make sure that you're taking care of yourself as well. Finally, we have volunteer caregivers. This can be a volunteer through a church, through a school program, through a community center. Typically, they're not getting paid because they are volunteers, and they may not have all the same qualifications as a professional caregiver. But nonetheless, they're there to spend at least a couple hours to help care for somebody. Let's take a moment to talk about specialized caregivers. First would be a certified nursing assistant or a CNA. This is somebody who's taken the time to go through a schooling and a program and has a certificate behind their name. CNAs oftentimes fill the gaps in personal care when registered nurses need to spend time doing other things on the floor. Second type of specialized caregiver would be a home health aide, which is the most popular and the most common that you would find. These are the type of caregivers that you would see in a professional setting as well as a private pay setting. A home health aide will still perform a lot of the same duties as a CNA in terms of personal and comfort care. Home health aides a lot of times you can find in the same settings as a CNA, but typically you'll find them at a client's home or a residential community center, or sometimes in an assisted living facility or independent living facility, just adding a little bit of extra care where a client may need it. We have a great video detailing the differences and similarities of a CNA and a home health aide. Click this link here to check it out. Next up, we have hospice caregivers. Hospice care is a very specialized role, and a hospice caregiver is going to be found only in a hospice setting. These are caregivers who specialize in providing comfort, compassion, and personal care at the end of life stage for a client. This allows the client to maintain their dignity as well as their comfort in their last stages of life. Next up, we have memory caregivers, or caregivers who specialize in working with clients who have dementia or Alzheimer's. Typically speaking, these caregivers have training in dementia or Alzheimer's care. They're going to be working directly with people who need that type of support. It doesn't look entirely different than what you would normally find in personal care, but it can have its ups and downs, especially with day-to-day changes. You know, some days a client may be better, some days they may be worse. So a caregiver who specializes in memory care will be trained in that. Finally, we have live-in caregivers. This is definitely a specialized type of caregiver. These are caregivers who live in or live with the client that they're servicing. There's a lot of stipulations that go with that, including how many hours you can work and how many hours they need to sleep, but it can be a right fit in some circumstances. So finally, let's talk about how to choose the right type of caregiver. First things first, evaluate your needs. What type of care do you need? Do you need specialized care for dementia or Alzheimer's? Are you in a facility? Are you at home? Are you living with somebody else? Secondly, what is your budget? What is realistic for you and your family? If you're having difficulty with any of this, a good home care agency would absolutely be able to help you narrow down the details and make the best choice for you and your loved ones.